You know that feeling, right? That one itch you just can't explain. It's not a bug bite, it's not a rash, it's just this maddening, constant itch that seems to pop up out of nowhere. Well, today we're diving into the really strange world of these phantom itches, where the problem isn't in your skin at all. Let's start with a classic. That one spot right in the middle of your back that you can never, ever reach. It's so universal, we literally invented a tool for it, the back scratcher. But what if the back scratcher isn't just for convenience? What if it's actually evidence of a much deeper medical issue? To really get what's going on, let's open our first case file. It's a real medical mystery about a man whose whole life was turned upside down by an itch on his arms that just would not quit. Okay, just try to imagine this for a second. For 6 years, 6 long years, this man, who was a nurse practitioner, had to deal with this constant, disabling itch and burning feeling on both of his arms. It got so bad that it was seriously messing with his ability to sleep. And he did everything you're supposed to do. He went from one specialist to the next, just trying to get an answer. But here's where the mystery really starts. Dermatology, they found no skin disease. Rheumatology, neurology, even psychiatry. Nobody could figure out what was causing his symptoms. He was just hitting one dead end after another. He tried all the standard stuff. He even got epidural steroid injections right into his spine. And yeah, those procedures helped a little bit, but the relief, it was always temporary. That maddening itch always came back. Turns out this condition actually has a name, brachioradial pruritus, or BRP for short. It's a very specific kind of chronic itch that shows up on the outer part of the arms and forearms. And what's interesting is that area often lines up with the C5 and C6 nerves that come out of your neck. Okay, so that was the arms. Now let's jump to our second case, which is going to take us right back to that classic, unreachable itch we were talking about at the beginning. So here we've got a 57-year-old woman, and look at this, a 6-year history for her too. Her itch was in that textbook spot just to the inside of her left shoulder blade. And it wasn't just an itch, she also had that pins and needles feeling. After years of scratching, it had actually changed the color of her skin, leaving this dark patch. Her condition is called nodalgia paresthetica, or NP. And here's the kicker. It's described as a very common, under-recognized condition. So this isn't some super rare thing. It's something tons of people have, but they often don't get the right diagnosis for it. So we have these two separate cases, right? Burning arms on one hand and itchy back on the other. Both have been going on for years. Both are a total mystery. And in both cases, there's nothing wrong with the skin. So what's the connection? This is the million-dollar question. If every skin expert says the skin looks perfectly fine, then where on earth is this absolutely maddening sensation coming from? And the answer? It's not on the surface at all. It's way deeper, down in the nervous system. The real culprit is something called a neuropathic itch. It's not a skin problem. It's a nerve problem. It's basically damaged or pinched nerves sending out faulty itch signals to the brain when there's nothing there to scratch. It's a false alarm. Let's just quickly break down the difference here. A normal itch, like from a mosquito bite, that's your skin reacting to something. Antihistamines, scratching, that usually helps. But a neuropathic itch, that's a wiring problem. The nerves themselves are generating the signal, which is exactly why creams and allergy pills do absolutely nothing to stop it. So, if the problem is really in the nerves, how do doctors finally track down where it's coming from? Well, the investigation has to go deeper, moving from the skin all the way back to the spine. Doctors basically become detectives, and they look for a very specific pattern of clues. The itch isn't just anywhere. It follows what's called a dermatome. That's the area of skin that's hooked up to a single spinal nerve. And there are other feelings too, like burning or tingling. Oh, and here's a really fascinating one, the ice pack sign. For BRP on the arms, putting ice on it brings this almost immediate major relief, which is a huge clue that the problem is nerve-related. So when all these clues start pointing towards the spine, that's when imaging, like an MRI, becomes the final piece of the puzzle. And sure enough, in cases like these, the scans showed the physical cause, things like herniated discs, bone spurs, or a narrowing of the spinal canal, all of it putting pressure on those nerves. Let's circle back to our first patient, the man with the burning arms. His MRI showed severe nerve compression in his neck. So he went in for surgery to basically decompress those nerves. And the result? It was incredible. He was instantly symptom-free. The itch that had tortured him for 6 years was just gone, just like that. Now, for notalgia paresthetica, that's the back itch, the treatment isn't always so straightforward. As you can see, there's a whole range of options. Some things, like capsaicin cream, work by kind of overwhelming and tiring out those faulty nerve endings. Others, like gabapentin, are medications designed to calm the whole nervous system down. And then you have physical approaches, like specific exercises or acupuncture, that try to relieve the physical stress on the nerve. The key thing is, every successful treatment is targeting the nerve or the spine, not the skin. The biggest takeaway here, the thing you really need to remember, is that some of the most stubborn, drive-you-crazy itches have absolutely nothing to do with your skin. They're phantom signals coming from a much deeper problem. And this isn't just some fringe idea. The connection is really, really strong. In one study that looked at patients with that unreachable back itch, over 60% of them had visible wear and tear changes in their spine that lined up perfectly with where they were feeling the itch. So, what's the bottom line here? First off, if you have a stubborn itch that's always in one specific spot and there's no rash, it might be coming from your nerves. Remember, brachioradial pruritus hits the arms, notalgia paresthetica hits the mid-back, and more often than not, the real culprit is a pinched nerve in the spine. Sometimes just knowing the real source of the problem is a huge step toward getting better. It really makes you wonder, doesn't it? If an itch can actually be a secret message from your spine, what other mysterious signals are our bodies sending us, just waiting for us to figure out the code?